perimenopause after 40, what your body is trying to tell you. Before we begin, please remember that this video is for general educational purpose only. It is not a substitute for personal medical service, diagnosis, or treatment. Symptoms that appear in your 40s may have many possible causes. Do not assume that every change is caused by perimenopause. Speak with a qualified healthcare professional about symptoms that are new, severe, persistent, or affecting your daily life. Do not begin, stop, or change hormone therapy, birth control, prescription medicine, or supplement without appropriate medical guidance. When you no longer feel like yourself, maybe it begins with sleep. You wake up at 3 in the morning and cannot understand why. Your body is tired, but your mind is wide awake. Then your period begins to change. 1 month arrives early. The next month arrives late. Some periods are lighter, others are unexpectedly heavy. You may feel hot in a room where everyone else feels comfortable. Your heart may suddenly race. You may forget a familiar word in the middle of a sentence. You may feel anxious for no obvious reason, or become irritated by something that would not have bothered you before. Perhaps you stand in front of the mirror and think, "What is happening to me?" For many women, these changes begin during a stage called perimenopause. Perimenopause means the years leading up to menopause. During this transition, hormone level can fluctuate, periods may become irregular, and symptoms such as hot flushes, night sweat, sleep problems, vaginal dryness, mood changes, joint discomfort, and difficulty concentrating may appear. Menopause itself is confirmed after 12 consecutive months without a menstrual period. Perimenopause is not a disease. It is a natural state of life, but natural does not mean imaginary, and natural does not mean you must suffer in silence. Some women experience every mid-changes. Others feel as though their body, sleep, emotions, work, and relationship have all changed at once. There is no single correct experience. Your symptoms may be different from your sisters, your mothers, or your friends. The purpose of this video is not to diagnose you. It is to help you recognize patterns, ask better questions, and understand that support is available. We will talk about menstrual changes, hot flushes, sleep, mood, brain fog, weight, heart and bone health, vaginal symptoms, intimacy, treatment choices, and the warning signs that should be ignored. Most importantly, we will talk about how to move through this transition. Without losing trust in your own body, take one slow breath. You are not becoming weak. You are not becoming difficult. You are not alone. What perimenopause actually means. Many women hear the word menopause and imagine one sudden event, but the transition usually happens over time. During perimenopause, the ovaries do not simply switch hormones off in one moment. Hormone production may rise and fall unevenly. That is one reason symptoms can feel unpredictable. You may have a difficult month followed by a month when you feel almost normal. You may have regular period for several months and then skip one. You may experience hot flashes for a period of time and then notice that sleep or mood becomes the bigger concern. Perimenopause often begins in the 40s, although timing varies from person to person. Menopause most commonly occurs between age 45 and 55, but medical treatment or surgery can also cause an earlier menopause. Age alone does not confirm the cause of your symptoms. Thyroid problems, pregnancy, anemia, medication effects, sleep disorder, depression, anxiety, and other medical conditions can sometimes resemble parts of the menopausal transition. This is why a recent healthcare conversation matters. You do not need to arrive at the appointment already knowing the answer. Your job is to describe what has changed. Try to notice patterns. When did the symptoms begin? How often do they happen? What affects your sleep? How has your cycle changed? Are you missing work? Are your relationships being affected? Are symptoms mild, uncomfortable, or overwhelming? These details are often more useful than saying, I just do not feel right. And please do not dismiss yourself because you are early 40. Perimenopause can begin before periods stop. You do not have to wait until menopause is complete before discussing symptoms or treatment options with a clinician. The experience is worth addressing now. Your period may change, but do not ignore every change. For many women, the first noticeable sign of perimenopause is a change in the menstrual cycle. Periods may come closer together or farther apart. You may skip a month. Bleeding may become lighter or heavier. The number of days may change. These changes can happen during perimenopause, but changes in menstrual bleeding should still be reported to a healthcare professional because abnormal bleeding can have causes unrelated to the menopausal transition. Track your cycle. You can use a calendar, notebook, or secure health application. Record the first day of bleeding, the number of days, how heavy it is, whether you pass large clots, and whether bleeding happens after sex or between periods. Also record symptoms such as dizziness, unusual weakness, shortness of breath, or severe pain. Seek medical advice for bleeding that is very heavy, lasts much longer than unusual, repeatedly occurs between periods, or happen after sex. Bleeding after menopause should always be evaluated. Once you have gone 12 months without a period, any new vaginal bleeding or spotting is not considered normal and should be checked by a healthcare professional. Do not use the word perimenopause to explain away every symptom. A natural transition and a separate health problem can exist at the same time. Another important part is pregnancy. Ovulation becomes less predictable during perimenopause, but pregnancy can still occur before menopause is complete. If you do not want to become pregnant, discuss contraception with a healthcare professional rather than assuming a regular period means pregnancy is impossible. The Office on Women's Health advised continuing birth control until 1 year after the final menstrual period, with personalized guidance from a clinician. This stage can be confusing because the body is changing, but it has not completed the transition. You deserve clear information rather than guesswork. Hot flushes and night sweat. A hot flush may begin as a sudden wave of heat in the chest, neck, or face. You may sweat. Your skin may become red. Your heart may feel as though it is beating faster. A few minutes later, you may feel cold. At night, this can become a night sweat. You wake with damp clothing or bedding. Then you struggle to return to sleep. Hot flashes are among the common symptoms of the menopausal transition and can continue for years for some women. Begin observing your own triggers. Some women notice that hot rooms, stress, alcohol, caffeine, spicy food, or smoking make symptoms more noticeable. Your triggers may be different. Keep a short record for 2 weeks. Write down when a hot flash happens, what you were doing, what you had eaten or drunk, and how intense the episode felt. This is not about blaming yourself. A hot flash is not caused by a lack of this cream light. The record is simply information. Use layers of clothing that can be removed easily. Keep cool water nearby. Use a fan when practical. Choose breathable bedding. Lower the room temperature if you can. If a hot flash begins during a meeting pause, take a slow breath, drink water. Remind yourself that the wave will pass. You do not need to feel embarrassed. Your body is not behaving badly. If hot flashes are frequent, intense, or disrupting work and sleep, speak with a healthcare professional. Lifestyle changes, non-hormonal medicines, or hormone therapy may all be considered depending on your symptoms and medical history. You do not receive an award for tolerating the greatest discomfort. Treatment is not a sign of weakness. It is a choice that should be based on good information. Why sleep can fall apart? Many gurus say that sleep is the symptom that affects everything else. You may fall asleep normally but wake in the middle of the night. You may wake after a night's sleep. You may feel anxious as soon as your eyes open. Or you may sleep for several hours and still feel unrefreshed. Hot flashes, night sweats, and mood changes can contribute to poor sleep during the menopausal transition. But not every sleep problem is caused by hormones. Snoring, pauses in breathing, restless legs, pain, medication, alcohol, depression, anxiety, and other conditions may also affect sleep. If you wake choking and loud snoring, experience severe daytime sleepiness, or repeatedly struggle to stay awake while driving, seek medical evaluation. Start with a simple sleep record for 1 or 2 weeks. Note when you go to bed, when you wake, how often sleep is interrupted, whether you had night sweats, and when you use caffeine or alcohol. Look for patterns rather than perfection. Create a consistent wind down period. Dim the lights. Reduce stressful work close to bedtime. Keep the bedroom cool. Place a change of clothing nearby if night sweats are common. Use bedding that can be adjusted easily. Try to keep your wake time reasonably consistent, even after a poor night. Be careful with caffeine late in the day, and do not rely on alcohol as a sleep treatment. It may make you feel sleepy at first, but can interfere with sleep later and may create other health risks. Over-the-counter sleep products and supplements are not automatically harmless. Discuss ongoing insomnia and any sleep aid with a clinician, especially if you take other medicines. Sleep medicines may sometimes be used for a short period, but they are not a long-term cure for insomnia. When you wake at 3 in the morning, do not immediately tell yourself tomorrow is ruined. That thought creates another layer of stress. Instead, breathe slowly. Keep the lights low. Avoid checking work messages unless necessary. Remind yourself, my body is having a difficult night. I can still care for myself tomorrow. Poor sleep may be part of perimenopause, but suffering every night without support does not have to be. Mood changes, anxiety, and feeling unlike yourself. One of the most painful parts of perimenopause is not always physical. It is the feeling that your inner reaction no longer belong to you. You may become irritated quickly. You may cry more easily. You may feel anxious before an ordinary event. You may lose confidence at work. You may feel overwhelmed by responsibilities you manage for years. These changes can be influenced by hormones, poor sleep, life stress, caregiving, relationship changes, work pressure, and existing mental health conditions. Midlife is often crowded. You may be raising children, caring for parents, managing a career, facing financial pressure, and noticing changes in your own body at the same time. Do not reduce every emotion to hormones. Your life circumstances matter too, but do not use life stress to dismiss a pattern that deserves attention. Try replacing self-treatment with specific language. Instead of saying I am becoming impossible, say I have been unusually irritable for 3 weeks. Instead of I am losing control, say I feel anxious every morning and it is affecting my work. Instead of I am weak, say I am sleeping poorly and I no longer feel able to recover. Specific language help a healthcare professional understand what is happening. Track work along with sleep and menstrual changes. You may notice that symptoms follow a pattern. You may also discover that they do not. Either result is useful. Support can include therapy, stress management, stretches, treatment for sleep or hot flashes, and medication when appropriate. If sadness, anxiety, panic, anger, or loss of interest is persistent or severe, seek professional care. If you are thinking about harming yourself or believe your family would be better without you, contact local emergency or crisis support immediately. Perimenopause may explain part of what you feel. It should never be used as a reason to ignore serious emotional pain. Brain fog is frustrating, but it does not define you. You walk into a room and forget why. A familiar name disappears. You lose your train of thought while speaking. You read the same paragraph 3 times. This can frightening. You may wonder whether you are developing a serious memory problem. Difficulty concentrating and forgetfulness can occur during the menopausal transition, and poor sleep, stress, and mood symptoms can make them worse. Use practical support instead of trying to force your brain to remember everything. Keep one calendar, write their appointments immediately. Use reminders. Create a place for keys and important documents. Perform one important task at a time. Reduce interruptions when you are doing work that requires concentration. Sleep, movement, nutrition, and stress management may also support cognitive function and overall health, but do not automatically label significant memory changes as not as stress menopause. Seek medical advice if confusion is sudden. rapidly worsening, affecting safety, or accompanied by weakness, speech changes, severe headache, fainting, or another acute symptom. Also, seek help if memory problem or interfering substantially with work, finances, driving, or daily life. A forgotten word can be a frustrating symptom. It is not proof that you are losing your intelligence. You have not suddenly become less capable. Your brain may be working under the combined pressure of hormone changes, disrupted sleep, and a very demanding stage of life. Give it support, give it structure, and speak to yourself with respect. Weight and body changes without shame. Many women notice that their body composition changes during midlife. Clothing may fit differently. Weight may become easier to gain and harder to lose. Fat may appear more concentrated around the abdomen. Muscle may decline if strength activity is absent. These changes are influenced by more than one factor: aging, sleep, stress, activity level, eating patterns, medications, and hormone changes can all contribute. Your body is not betraying you, and you do not need to punish it. Extreme diet may promise to reset hormones or reverse menopause. Be cautious. No single fruit, tea, powder, or supplement can guarantee a smooth transition. Some products may interact with medicine or be unsuitable for certain health conditions. Focus on habits that support your whole health. Eat regular meals that include nourishing foods you enjoy. Include sources of protein, fiber, fruit, vegetable, and other foods appropriate for your medical needs and culture. Drink water. Reduce the patterns of skipping meals all day and eating everything at night. Move in ways you can maintain. Walking matters, strength training matters, balance matters, rest matters. You do not have to chase the body you had at 25. The goal is not to become smaller at any cost. The goal is to support energy, strength, blood pressure, blood sugar, mobility, bone health, and confidence. If weight changes are sudden, extreme, or accompanied by other symptoms, speak with a healthcare professional. Your body deserves investigation, not shame. Heart and bone health after 40. Perimenopause is not only about period and hot flashes. It is also a useful time to review long-term health. After menopause, lower estrogen level and other age-related changes are associated with increased risks such as cardiovascular disease and osteoporosis. This does not mean menopause suddenly causes a heart attack or a broken bone. It means prevention deserves attention. Know your blood pressure. Discuss cholesterol, blood sugar, family history, smoking, physical activity, and wait with your healthcare professional. Seek emergency care for certain symptoms that could indicate a heart attack or a stroke, including severe chest pressure, major difficulty breathing, sudden weakness, no one side, or difficulty speaking. Protect your bones through appropriate weight-bearing activity, strength, exercise, nutrition, and medical screening when recommended. Ask whether you need to refill calcium, vitamin D, or bone density. Testing based on your age, medical history, medications, and risk factors. Do not begin high doses of supplement simply because an advertisement says women over 40 need them. More is not always safer. A clinician can help determine what is appropriate for you. This is also a good time to maintain routine preventive care. Keep up with blood pressure checks, cervical screening when recommended, breast screening based on current guidance, and your personal risks, dental care, and other age-appropriate evaluations. Perimenopause is not the beginning of decline. It can be the beginning of more informed care. Vaginal dryness or urinary symptoms and intimacy. Some symptoms are difficult to discuss. You may experience vaginal dryness, burning, itching, discomfort during sex, or changes in sexual desires. You may notice urinary urgency or irritation because the topics are private. Many women remain silent, but silence can turn a treatable problem into months or years of discomfort. Vaginal dryness and pain during sex can occur during the menopausal transitions, and both over-the-counter and prescription options may help. Do not force yourself through painful sex. Pain is not an obligation. Speak openly with your partner. You might say, "My body is changing, and I need us to slow down. This is uncomfortable, and I want to find a solution. This is not a rejection of you." A lubricant may help during sexual activity, while vaginal moisturizer are generally used regularly rather than only during sex. Ask a healthcare professional which option is appropriate for you, especially if you have irritation, bleeding, unusual discharge, or a history of hormone-sensitive medical conditions. Prescription options may include local vaginal estrogens or other treatments depending on your symptoms and health history. Sexual desire can also change because of poor sleep, stress, mood, relationship tension, pain, medication, or body image concern. There is no required level of desire. The goal is not to return to someone else's definition of normal. The goal is comfort, consent, communication, and well-being. Seek medical advice for persistent pain, bleeding after sex, sores, unusual discharge, or urinary symptoms. Not every intimate symptom is caused by perimenopause. You deserve an examination without embarrassment. Hormone therapy and other treatment options. Many women hear completely opposite messages about hormone therapy. One person says it is dangerous for everyone. Another says every woman should take it. Neither statement is responsible. Menopausal hormone therapy is a prescription treatment that can relieve symptoms such as hot flashes, night sweats, sleep problems related to menopause, and vaginal dryness. It can also help prevent bone loss in some women, but treatment is individual. The benefits and risks depend on factors such as your age, symptoms, time since menopause, whether you have a interest, personal, and family medical history, and the type, dose, and route of treatment. Some women should avoid certain hormone treatments. Others may be appropriate candidates. These decisions should be made with a qualified clinician, not through a social media comment section. If you still have a uterus and use systemic estrogens, a progestogen is often needed to protect the uterine lining. Different forms of therapy include pills, patches, gel, sprays, and local vaginal treatments, and they do not all have identical use or risk profile. Ask clear questions. What symptoms are we treating? What are the expected benefits? What are the risks for someone with my history? Which form and dose are being considered? How long should I try it? What side effects should I report? When will we review the treatment? Hormone therapy is not the only option. Depending on the symptom, non-hormonal prescription medicines therapy for mood or sleep, vaginal moisturizers, and lubricants, lifestyle adjustments, and other targeted treatments may be considered. Be cautious with supplements marketed as hormone balancing products. Natural does not mean risk-free. Some products may affect bleeding or interact with prescription medicine. Tell your healthcare professional about everything you use, including vitamins, herbal products, and over-the-counter sleep aids. The best treatment is not the most fashionable treatment. It is the option that addresses your symptoms while respecting your health history and preferences. How to prepare for a medical appointment. Many women leave a medical visit feeling that they were not had. Sometimes this appointment is too short. Sometimes symptoms are described too generally. Sometimes embarrassment makes the most important concern stay unspoken. Preparation can help. Before the appointment, write down your 3 biggest concerns. For example, my period have become much heavier. I work every night and cannot function at work. Sex has become painful. Bring a symptom record. Include cycle changes, hot flashes, sleep, mood, headache, vaginal or urinary symptoms, and any new medicines or supplements. List your medical history and family history. Mention blood clots, stroke, heart disease, breast or uterine cancer, liver problem, migraines, and other conditions that may affect treatment decisions. Bring a complete medication list. Then ask, could something other than perimenopause be causing these symptoms? Do I need any tests? What treatments are available for my main symptom? Is hormone therapy appropriate for me? What non-hormonal options exist? Do I still need contraception? Which bleeding changes require urgent evaluation? What preventive screenings should I schedule? Do not afraid to say, this symptom is affecting my quality of life. You do not need to prove that symptom is severe enough. If it bothers you, it deserves a conversation. The Office on Women's Health recommends discussing symptoms that affect you and reviewing treatment choices in the light of your age, health risks, medical history, and preferences. If you feel dismissed, ask for a clear explanation or seek another qualified professional when possible. You are not asking for special treatment. You are asking for informed care. A 7-day perimenopause health reset. You do not need to change everything this quick. Begin with 7 small actions. Day 1. Start a symptom record. Write down your sleep, period changes, hot flashes, mood, and energy. Use simple words. Do not try to diagnose yourself. Collect information. Day 2. Protect tonight's sleep. Choose one improvement. Lower the room temperature. Prepare lighter bedding. Move caffeine earlier. Silence unnecessary. Notifications. Create a short window routine. Day 3. Eat for steady energy. Plan one balanced meal instead of skipping food until you are exhausted. And something nourishing rather than creating a list of forbidden foods. Day 4. Move for strength. Take a walk. Perform a safe strength routine. Stretch gently. Choose a form of movement that supports your body instead of punishing it. Day 5. Have one honest conversations. Tell someone you trust what has been difficult. You can say, I think I may be going through perimenopause and I have not felt like myself. You do not need to explain everything. Day 6. Prepare your medical questions. Write down the 3 symptoms affecting you most. Make medications and supplement list. Schedule an appointment if symptoms are disrupting your life. Day 7. Review without judgment. Ask, which symptoms affect me most? What makes it worse? What happens? What helps? What am I afraid to discuss? What support do I need next? Then choose only 2 actions to continue next week. Consistency is more useful than perfection. This is a transition, not the end of you. Perimenopause can make you feel as though your body has changed the rules without telling you. You may miss the predictability you once had. You may miss sleeping through the night. You may miss feeling calm, focused, confident, or comfortable in your own skin. But this transition is not the end of your health. It is not the end of your strength. It is not the end of your sexuality, your intelligence, your ambition, or your choice. Your body is changing. That does not mean it has stopped belonging to you. Listen to it. Track what is happening. Ask questions. Seek care for symptoms that disturb your life. Do not ignore unusual bleeding. Do not dismiss persistent emotional pain. Do not force yourself through painful intimacy. Do not Use same as a health plan. Do not let anyone convince you that suffering is simply the price of being a woman over 40. You deserve accurate information. You deserve treatment choices. You deserve sleep. You deserve support. You deserve to feel heard. Tonight, choose one small action. Write down your symptoms. Drink water. Move your body gently. Talk to someone you trust. Schedule an appointment. Or simply look in the mirror and say, I am not imagining this. My experience matters, and I am allowed to ask for help. If you found this helpful, please like and follow for more.